Pain in cancer patients. Pain reduces the quality of life for many cancer patients. Pain prevalence in cancer patients, 64% of patients with advanced cancer. In about 43% of these cases, pain control is insufficient. Korean study, 52% of cancer patients complained of pain. Classification of cancer pain according to physiologic mechanism. First, nociceptive pain. Pain caused by stimulation of nociceptors due to organ damage. Classified as somatic pain and visceral pain. Most can be controlled with non-narcotic and opioid analgesics. Neuropathic pain, pain caused by abnormalities in the central nervous system and peripheral nervous system. It is accompanied by neurological abnormalities such as allodynia, which feels pain even with stimuli that do not cause pain, or paresthesia in the area governed by the damaged nerve. Concomitant administration of adjuvant analgesics and interventional pain treatment are often required for analgesic treatment. In most cases of pain experienced by patients with advanced cancer, the mechanism of the nociceptive pain and the neuropathic pain are mixed. Classification of according to the temporal occurrence pattern of pain. First, persistent pain. Second, sudden pain. Pain that gets worse intermittently when the pain is controlled. Pain that worsens with movement, such as pain due to spinal metastasis. Temporarily worsening pain. Reported in about 60% of cancer patients and 80% of patients admitted to hospice. According to a domestic study, it occurs at a frequency of 3 or more times a day in 45% of cancer patients. Assessment of cancer pain. General principles. Be sure to check for pain when treating all cancer patients. Use the pain assessment tool to screen the presence of pain and measure and record the pain intensity. A comprehensive pain assessment is performed on all patients who complain of pain, including those who have had previous pain and those who are new to it. For effective pain management, educate patients and families to use assessment tools at home. Second, comprehensive assessment. Target, finding the cause and the mechanism of pain. Analyze factors that may affect pain expression. Combining all factors to find an appropriate treatment method. Patient with severe cancer pain. Rapid and appropriate pain control according to emergency situations is required. Comprehensive assessment. Evaluation items, history of pain, current pain treatment history, response to treatment, presence of breakthrough pain. Assessment of cancer-related symptoms other than pain. Current cancer status and cancer treatment evaluation. Other comorbidities and the history of chronic pain prior to cancer diagnosis. Psychosocial assessment. Evaluating the patient's expectations for pain control and the impact of pain on daily life. Physical examination. Appropriate tests such as blood and imaging tests. Knowledge and misconceptions about pain and pain control. Examples of misconceptions about pain and pain control. Being in pain means that the disease is getting worse. Painkillers are addictive. If you use painkillers from the beginning, you may not be able to control the pain later. Pain relievers should be used only when the pain is unbearable. Painkillers are harmful to the body. Complaining of pain prevents doctors from focusing on cancer treatment. Continuous assessment. Periodically evaluate the effectiveness of pain treatment, side effects, and adherence to treatment. Evaluate whether scales such as numerical pain grades have improved and the patient's subjective pain level of improvement. Pain should be evaluated 15 minutes after intravenous administration or 1 hour after oral short-acting drug administration when opioid analgesics are administered to hospitalized patients. For outpatient, leases every few days to weeks, depending on the severity of pain. Assess for constipation, nausea, vomiting, somnolence, and other adverse neurological side effects. If the pain pattern changes or new pain occurs, the pain is re-evaluated as a whole. Educate patients and their families on the use of pain self-recording papers to report change in pain patterns, etc. Choose one principle of cancer pain treatment. Choose an appropriate treatment method for each patient. Plan a multidisciplinary treatment. Educating patients and families about pain management. Opioid analgesic. General principle. Individually select the appropriate opioid type, dose, and route of administration for each patient. The route of analgesic administration is given priority, but an appropriate route is selected according to the situation. Those that can control pain without side effects. Pain can be controlled by administering opioid at any stage of pain intensity. Side effects management of opioid analgesics. First, constipation. Stimulant laxatives and osmotic laxatives are administered as prophylaxis as a tolerance dose, not develop and persist during opioid analgesia. Constipation persist. Differentiation of intestinal obstruction and fecal infection. Narcotic analgesic conversion. Consider adding gastrointestinal motility boosters. Delirium, respiratory depression, others, urinary disorder, itching. Pain treatment method used in modern medicine, HAPET, ultrasound, TENS, ICT, laser, PO, injection, nerve block, fluorotherapy, acupuncture, chiropractic treatment, hyperthermic therapy. Hyperthermic therapy, remission 1, heat therapy applied to cancer patient. Principle, increase in body temperature, blocking DNA replication in cancer cells, NK cell activation. Pain reduction, reducing pain with a principle similar to low-frequency therapy. Effects of heat treatment, change occur in metabolic activity, hemodynamic function, nerve response, musculoskeletal activity, and physical properties of collagen tissue. Increase the rate of oxygen absorption in tissues. Therefore, more nutrients are usually used to promote this tissue healing. When heat is applied to one part of the body, blood flow to the skin increases to the extremity of the body. Change the ability of heat to raise pain threshold, change in nerve conduction velocity, and changes in firing rate of muscle spindles. Remission 1, the energization method generates frictional heat by directly contacting the human body and vibrating intracellular ions and polarized molecules. Other types, in the radiation method, radio waves generated from the ceramic vibrate adjacent cells to generate carriage heat. Remission is a choice of treatment of cancer pain. My opinion. Conclusion. Remission 1 used to treat pain is more efficient than other device. Thank you.